Hello everybody, my name is Dr. Steve Mortazavi at Valley Pain Specialists, and what you're going to see today in bits and pieces is essentially a therapy called spinal cord stimulation. This is a treatment modality reserved for patients who have failed most conservative treatments, who have back or neck pain, typically after back or spine surgery. We're with this patient who was kind enough today to let us record and teach a little bit of you what this is about. And essentially what this involves is passing a small wire, as you can see, and I'm not sure if you can see the actual lead here, if you can take a look at it, but it's an 8-contact lead and there are metal contacts at the end of this wire. And what we're going to do is simply with a needle, this procedure is essentially done just through a needle. It's very simple. The patient is awake, she's slightly sedated, but it's otherwise an outpatient office type of procedure. Pass this into her spine, have it rest on the back of her spinal cord, and then take the other end of this cable and attach it to a battery, which we'll show you later. And then the patient can deliver electrical sensations through these contacts to stimulate her spinal cord, which will block the unpleasant pain sensation and replace it with a more pleasurable pins and needles types of sensations. So stay tuned. We do have other videos on our YouTube channel showing this type of procedures as well as other types of procedures. And if you have any questions, feel free to contact our office at 610-954-9040. Tell me when.
Yeah.
Okay, so now at this point, audience, we have placed the needle into the epidural space, which is shown right here. And you can also see that on the x-ray screen there, that this is between her spinal vertebrae, in this case L1 and 2. And what we're going to do is pass this wire, or spinal cord stimulator neuroelectrode, through the needle and have it go up the epidural space rostrally to approximately the T9 level. So we'll go ahead and do that now and show the end in a minute. Okay guys, so what we've done is we've placed the spinal cord electrode through the chewy needle, and it's residing up about here behind the T9 vertebral body. The folks from the Medtronic company have used wireless Bluetooth technology to remotely stimulate this device with electrical current from across the room, and the patient has felt paresthesia or pins and needles on the left side of her body, including the left low back, buttock, and leg, which is where she has her pain. It was sometimes these patients, it can be difficult during these treatments to get the patients to feel and perceive the stimulation where you want, but we were able to achieve that today. If you look at the monitor on the left, you'll see the 8-contact lead traveling from the lower back area up to the T9 area, which is marked there just slightly left of midline. So now at this point, what we're going to do is detach the Bluetooth transmitter, withdraw the needle, and make a small incision right here. And I don't know if you can see this on the buttock, but this is where her battery will go. We'll make a small incision here and put a battery under her skin and connect the battery to the lead so that everything will be internalized. She won't have something like this. It'll be a much smaller device that'll be internalized, and then that battery should last for several years, and she can program that remotely with a patient programmer that we'll give her. So now, as the audience can see, we've made a little incision here, and I'm not sure if you can zoom in there and you can see there's a small incision, and this is very small. This is a minimally invasive treatment, okay? It's only about a 2-inch incision that's only about a 1/2 inch deep. The wire is entering her epidural space further down and then residing up about here. Now I need to anchor this wire or lead down to her fascia there so it doesn't get pulled out. So there's a device that Medtronic has here, and we're going to slide this over the end of the lead. Simply slide it over here like this. Okay. And it comes out, and then we advance it down.
And when it gets in.
Slide it all the way down to here, and this will anchor that little anchoring device. It'll cinch it around the lead itself, and then we can just sew that down with some silk tie to the fascia. So we're going to go ahead and squeeze it right here, and then gently remove the anchoring device. And now we have the anchor right over the lead, and now I can just go ahead and take a tie and tie that right down so it won't move. Once that's done, we'll go ahead and take this lead and we'll tunnel it under the skin. So this is like a shish kebab skewer essentially, and we'll tunnel from one end to the battery over here. There's a little sheath, a plastic sheath, and this wire will go through that sheath, and then I can attach this end of the wire to the battery, which we'll show you in just a little bit. Okay, so what we've done now is we've attached the lead, tunneled it underneath the skin, and attached it to this implanted programmable impulse generator. And we've implanted the generator and we've tested it. And now even when this is implanted under the patient, you can see how small this is. Isn't this small? This is fantastic. Look at how tiny these batteries are. And this will go for 3, 4, 5, 6 years, maybe even more. Try like 8 or 9 years with these new batteries, and they're pencil thin. So basically, we'll implant this in here, we'll irrigate everything out. The patient will be left with 2 small incisions, and that's basically the end of this treatment. So thank you very much for your attention. Once again, if you have any questions, call Valley Pain Specialists. That's Valley Pain Specialists in Bethlehem, Pennsylvania, 610-954-9040, 954-9040. Thanks.